In this video, a Dr. Gastroenterologist, candidate of medical sciences, will answer questions from our viewers about digestive problems, GI diseases, heartburn, what and when you can eat, gluten, lactose, fasting, colon cleansing, constipation, gas, food poisoning, and many other issues. The material turned out to be very interesting, and most importantly informative. If you want to become a master of your health, put a like, and we will begin. Dear viewers, further, in order for you to get the most out of this video, I suggest you focus on what I will say, not on what I will show on the screen. Just listen and go about your business at the same time. So now I'm going to read out the questions from the viewers and the answers from our esteemed doctor. First question: what causes excessive gas? Excessive gas, its causes and how to deal with it is a topic that needs attention. Gas formation can be caused by various factors. For example, eating fiber-rich foods such as beans, cabbage, and corn can cause gas because they contain substances that break down to produce gas. People may unknowingly consume these foods frequently, leading to increased gas. Therefore, it is important to pay more attention to what you eat and monitor your diet more closely. It is also possible that increased gas is related to diseases such as pancreatic cancer, gastric atrophy, or impaired intestinal peristalsis. Gallbladder problems or digestive disorders may also contribute. Some people resort to various methods, such as stimulating the secretion of bile to deal with gas. However, this may not be effective and may lead to intestinal irritation and other negative effects. It is important to remember that drinking bile or excreting bile are not scientifically proven methods of treating gas and can be dangerous to your health. It is better to seek the advice of a qualified professional and follow the recommendations for dietary and lifestyle changes to improve digestion and reduce gas. Next question: how often should there be stool? Normal stool should be daily, once a day, provided that the consistency is normal. You need to push, but not hard. The color and smell of stool can vary in different shades of brown, and the absence of odor is quite normal. However, this is not a rigid rule, but rather an interval, since the amount and condition of the stool can vary depending on the amount of food consumed. It is important that the stool has a certain shape and consistency. Shapeless stools that look like mush may indicate improper digestion. General stool analysis, which is still widely used, is done manually by lab technicians, which can be a long and laborious process. The lack of automated analyzers often leads to errors in the test results. Next question: is it necessary to eat every 4 hours? Actually, the digestive system is quite a long journey. Dear viewers and dear listeners, let's discuss how long the intestines can be. What do you think? On average, according to various reports, it's between 7 and 8 meters long when you unwind it. That's almost 10 steps of 70 centimeters each. When we talk about digestive problems such as heartburn, belching, or heaviness, we usually focus on the stomach, pancreas, and gallbladder. Even though they are only at the very beginning of the digestive system, we often forget that the other 6 or 7 organs also play a role. This has started to change in recent years, but it's important to realize that the gut is a huge conveyor belt. The regularity of food intake only affects the beginning of it, then everything is smoothed out by the speed of the movement. For the gut, it doesn't matter as much how many times a day you eat because it just gets food, but for the stomach it does. It's important for the stomach to get regular meals to adapt to the routine. This adaptation process can take about 2 weeks. The pancreas, which secretes enzymes, also changes the ratio of enzymes depending on what you eat, and this process also takes time, about 3 weeks. So everyone can adjust their eating schedule to suit themselves, and it takes about 2 weeks. Next question: is it mandatory to eat breakfast? It is not at all necessary to eat breakfast right after waking up. You may be in a hurry or just don't want to eat right away. You can have a cup of tea or coffee and have breakfast later, even at lunchtime, not necessarily right away. You know, it's very important to wake up in the first hour after waking up, because even today one patient was telling me that if she didn't wake up right away, the whole day would drag on. For example, if you don't feel the urge to go to the bathroom right after waking up, it can lead to problems throughout the day. Therefore, sleep is very important for the body, and you should give yourself time to wake up to start functioning normally. After that, you may feel hunger or the urge to go to the restroom. If your schedule is such that you start to feel more awake on your way to work and feel hungry, you can eat breakfast there, and that is perfectly fine. The recommendation to eat breakfast as a mandatory meal may be important in some cases, such as certain medical conditions where the feeling of hunger is impaired due to stomach inflammation. However, for healthy people, it doesn't matter when they eat breakfast, whether it's 5 minutes after waking up or 2 hours later when the feeling of hunger appears. It doesn't affect their stomach in any way. Next question. What does the odor of breath indicate? Talking about breath odor implies several groups of causes. The first, the most common, is related to dental problems. Often, breath odor can indicate hidden dental problems, such as decay under fillings or between teeth that are not always visible during a routine exam. Such problems can often be detected with a panoramic X-ray of the jaw. The second group of causes involves problems with the tonsils, worn teeth, or air stagnation in small areas of the mouth. Even if these problems do not cause pain, the microbes living in these areas can release odor-causing substances. The third group of causes is related to gastrointestinal conditions. Various problems can occur in the gastrointestinal tract, including valve defects that cause food or gases to back up, as well as bacterial activity and digestive processes that can contribute to odor. Of particular interest is the intestine, which is home to microorganisms that produce gaseous digestive products. These products can be absorbed into the bloodstream and dispersed throughout the body, which can lead to mouth odor. It's important to distinguish mouth odor from nasal odor, which can be caused by other things. An external examination is usually required to determine the source of the odor, as it can be difficult for the person themselves to distinguish one from the other. Next question. How can I determine if I am truly lactose or gluten intolerant? When a person has these thoughts, something has to trigger them. If a person does not have any obvious pain sensations, they are not likely to think about a possible intolerance. However, if any symptoms appear, we start to consider different options instead of immediately doing a more thorough gut examination. Therefore, if we want to confirm intolerance, we need to consider different factors. The first type of intolerance is related to genetics, perhaps from birth or after stressful events. When we drink milk and have symptoms, this can raise suspicion. If a genetic test shows a positive result, we can assume that we have a genetic predisposition. However, this does not always mean that the cause is only genetics. There may be another problem in the gut that we don't notice. Confirmation of intolerance can be obtained during a gastroscopy, when specialists check for intolerance and determine if there is one. It's important to remember that intolerance can be related not only to genetics, but also to irritation, inflammation, or allergies to certain ingredients. Distinguishing an intolerance from a simple ailment is important in order to properly diagnose and treat the problem. Next question. Are there benefits of fasting or so-called detox for the intestines and stomach? When we consider the question of benefit or harm, we are primarily interested in the purpose of fasting. The goals can be different. For example, a person may fast to lose weight or to get rid of certain symptoms and improve health. These two uses of fasting imply different goals. It is important to realize that in any case, whether it is to lose weight or to improve health, fasting temporarily deprives the body of necessary resources. It can be compared to the situation when we fill up the fuel tank of a car and drive on a full tank with no problem. But then we decide to drive with half a tank, and halfway through we have to push the car. It is exactly the same in our body. We eat as much as we have enough to eat, and we take the remaining half of our energy from our reserves. In terms of weight loss, this can be compared to uncorking a bottle, which may be helpful, but in terms of feeling better, ineffective. However, when we fast, relief comes because stress hormones are released, which in turn can improve mood and energy. Our body gives us these signals to find food, but if we don't, we use this relief as a temporary resource. Next question. What about the idea that organs need rest? Yes, some people believe that the stomach needs rest so that it doesn't overwork itself. Okay, then I have a counter question. Do the lungs need rest because they're breathing all the time? Try not breathing for 3 minutes. Let the lungs rest. Does the heart need to rest because it's constantly working, so sometimes you need to take a little break? Let's stop the heart. Let it rest too. The same is true for the brain. And in fact, the whole body needs time to rest. But for some reason, we have a double standard. We tell some people that they need to rest and others that they don't. But it's not the body itself that makes this decision. It's us. The skin, for example, needs a break from makeup. We think that's obvious. But what does rest mean for the heart? We can't just stop it, like other organs, because they work continuously. If we try to slow down the intestines or stomach, it will cause problems because all organs work interconnectedly and continuously. Next question. Is it necessary to do a detox? To me, the word detox is so annoying that I don't even hear it. And my brain, you see, just balks at the word. When we talk about detoxing from toxins, I myself have a question. What exactly are the toxins we need to get rid of? We know there aren't any. So why do we come up with this pseudo-ritual of cleansing? If we just want to relax, unwind, go somewhere, why create this false myth of cleansing ourselves of something? Our body has natural ways of self-cleansing such as urination, defecation, exhaling air and excretion through the skin. Our body does a great job of excreting harmful substances on its own. If you go to the toilet once a day, this is already the best way to detoxify, and you don't need to do anything else. There's no need to use enemas or flush anything. You just need to make sure that you are getting enough fiber in your regular diet. And if you are having trouble going to the toilet regularly, it could be due to not enough fiber in your food. Next question. How do I realize that I have chronic gastritis? When we encounter chronic digestive problems such as gastritis, it is important to understand when to see a specialist. Chronic problems usually indicate the need to consult with a gastroenterologist, but it is important to be diligent and pursue treatment results. Most digestive system problems are incurable, and it is important to seek a solution. However, when our problems become chronic, we often find ourselves in a constant cycle of exacerbations and remissions, which can lead to serious consequences. It is important to realize that chronic gastritis and gastric dysfunction can have different consequences. The constant damage and repair of stomach cells can lead to serious complications, including cancer. Therefore, it's important to seek treatment and understand the difference between true inflammation and just stomach dysfunction. Next question. When should I see a gastroenterologist? Determining when you should see a gastroenterologist is not easy. There are some signs that may indicate the need to see a specialist. For example, if you are experiencing frequent bouts of heartburn, gas, or diarrhea, this may be a signal to seek help. A gastroenterologist specializes in problems related to the digestive system. He or she can help if something is not right in your stomach, intestines, liver, gallbladder, or pancreas. Everyone can have digestive problems from time to time, but if they happen too often, it's worth seeking counseling. Next question. How do you know if a doctor is good? Unfortunately, we often think of medicine as a service industry, similar to a car service. Determining the quality of services is as difficult as determining a good hairdresser. Unlike goods, services cannot be replicated exactly. Even a good gastroenterologist can misjudge a patient due to various factors such as mood or external circumstances. In medicine, it is difficult to strive for perfection, but it is more important to evaluate a specialist on his or her results. The medical process should lead to results, not just treatment. If you are offered a long-term treatment with no concrete results or prognosis, it can be questionable. The key is to understand what to expect from the treatment and to have a clear understanding of its stages and timing. Next question. What myths from the so-called Middle Ages still live in our heads today? In the Middle Ages, analyzing the acidity of stomach contents was akin to mysticism. Someone determined the presence of belching by conducting a test with baking soda. Nowadays, even celebrity doctors, such as those with millions of Instagram followers, gave advice based on such tests. However, this is medieval healthcare, not science. We have an acidity scale, but it is impossible to determine increased acidity with such tests. Acidity cannot be raised or lowered based on whether there has been burping. Acidity does not affect the possibility of burping. Today, we use more accurate methods such as gastroscopy to determine the condition of the stomach and its acidity. Using litmus paper or probing is ineffective. We need to ask the right questions and refer to evidence-based methods rather than resorting to myths and legends. Next question. What are the most common mistakes your patients come in with? Sometimes the information in the report and what was told to the patient don't match. For example, I had a patient come in today with an MRI. The report says that the liver is not enlarged. Right lobe 19 centimeters, normal 15. Left lobe 12 centimeters, normal 10. This discrepancy is sometimes seen. Could the stomach or intestines be enlarged? It is possible. For example, if a person starts eating more, their stomach adapts to the new portion size. This process can take several weeks. However, if the stomach is overly distended, as in the case of a patient whose stomach turned out to be 5 liters in size, recovery can be difficult. In such cases, surgical intervention may be required. The intestines may be congested due to accumulation of gas or fecal matter. Constipation from childhood or improper toilet behavior can lead to such problems. Next question. Is it true that the calmer a person is, the better their bowels work? Some people are very calm and rarely feel the need to go to the restroom, perhaps because of their lifestyle or culture. They may not eat much or pay much attention to the regularity of their stools. But this does not always directly affect bowel function and health. For example, severe nervous tension can cause anxiety, which can affect bowel function. Anxiety and stress can cause an increase in bowel contractions, which can lead to diarrhea. On the other hand, stress can cause the intestinal peristalsis to slow down, which can lead to constipation or cramping. These bowel problems are not always related to a person's temperament, but rather to psychological state and stress. Next question. Why do some people say, "My stomach can't digest that"? It's a pretty common belief that the stomach has to digest food or something like that. All the limitations and burdens associated with its function are closely related to this point. We are discussing the stomach only in the context of its basic function, which has absolutely nothing to do with digestion. Essentially, the stomach is a sac into which food from the plate enters through the mouth and esophagus for further digestion. Its main job is to stretch and accommodate food, so its size depends on the volume of food. Its exit opening is only a few millimeters in size, but it stretches slightly to allow the mixture to pass through the esophagus. The stomach's main function is to mechanically process food, similar to the way a meat grinder or blender works, only inside. It also sanitizes food by killing germs thanks to the acid produced by the stomach. The volume and consistency of food affects the stomach, but its condition is independent of the food itself. Some people with a sick stomach notice relief by switching to porridge as it reduces the strain on the stomach. But this is not a cure. The disease may continue to progress even if the symptoms seem to have disappeared. Next question. What is leaky gut syndrome? Colon syndrome, or holy bowel syndrome, doesn't actually mean actual holes in the intestines that lead to perforation and serious consequences. The term that has become popular is used in a figurative sense. It refers to an increase in the permeability of the intestine, where the distance between the cells increases and the contents of the intestine begin to leak through the walls. This permeable space can be increased in various parts of the body, not only in the intestine, and can cause various symptoms such as swelling, redness, and irritation. This increase in permeability is often associated with various diseases and can affect bowel function and the microbial environment in the gut. However, it is important to note that it does not directly affect nutrient absorption, as permeability is only increased in the upper layers of the intestinal wall. Instead, it can lead to irritation of the intestine and impaired motility, which can cause increased gas and changes in stools. Next question. Is it helpful to take enzymes when overeating? There is a common misconception that enzymes help digest food more easily when overeating. Sometimes we hear that the stomach is supposed to digest food, so marketing and misunderstandings create the illusion that these pills will solve the problem. However, they are actually ineffective. When you overeat, your stomach stretches, causing discomfort. Instead of taking enzymes, it is important to speed up the process of evacuating food from your stomach. Enzymes won't help because they are inactivated by stomach acid or used in a coating that dissolves in the intestines when the food has already left the stomach. They may ease the mind, but there is no real benefit from them. Enzymes may only be useful in pancreatitis when the pancreas does not produce enough enzymes. However, the enzymes in pills are usually not enough for this. Therefore, it is more useful to drink vitamins or activated charcoal instead, which can also stimulate gastric motility. When overeating, we advise not relying on enzymes, but using tactics to empty the stomach quickly, such as drinking cold water. This will help the stomach empty itself of food more quickly. It's best to avoid overeating. And if you do overeat, use simple methods to get rid of the feeling of heaviness in your stomach. Next question. Tell me about laxatives. I once heard from a girl who was a figure skater and had a great figure about how she resorted to regular use of laxatives as part of a weight loss program. This story really struck me. She was feeling a little heavy after her workouts and decided to go on a water diet. As a result, she lost some weight, but felt it wasn't enough and started using laxatives. This led to even more weight loss, but the problem started when her body began to react to the lack of nutrients. Instead of addressing her weight and digestive issues through diet and lifestyle changes, she fell into a detrimental cycle that led to depression and body malfunctions. She was initially healthy and slim, but as a result of improper weight loss methods, her health and fitness came into question. Such stories, while common, carry huge risks and are unacceptable. Weight loss programs that are not based on diet and lifestyle changes can be detrimental to the body. It is important to remember that the way to a healthy weight and wellness is through proper diet, active lifestyle, and taking care of your body, not through laxatives and other harmful methods. Next question. Tell me about stomach and intestinal pain. Often people confuse stomach and intestinal pain. To understand where the stomach and intestines are located, it is best to refer to yourself. The intestine is located in a P or M shape, depending on individual anatomy. It has different parts along the edges and in the middle, including the large and small intestine. However, due to contamination of the abdomen, it can be difficult to distinguish its parts. The stomach is often confused with the gallbladder or pancreas. The confusion is caused by the upper part of the stomach, which is approximately at the level of the abdomen. It can be identified by a doctor's examination or by listening to the abdomen. The stomach is usually on the left side, under the ribs, and the intestines pass through the navel. Abdominal pain can be caused by a variety of reasons, including intercostal neuralgia, which is often felt as a shooting pain between the ribs. It is important to learn how to distinguish between the different sensations in order to more accurately determine what is going on in the body. This topic is quite difficult to understand, and we cannot always articulate it accurately and in detail. However, we can make a few hints and assumptions to roughly orient ourselves. First, we pay attention to the location of sensations and, based on them, try to determine where the stomach and intestines are located. However, there are some nuances that can mislead us, such as irradiation of pain or pain sensation to other parts of the body. We also pay attention to the relationship to food intake. If the pain occurs immediately after eating, it is most likely the stomach. If the connection to food is not obvious, it could be the intestines. Making assumptions is important because sometimes we misinterpret stomach pain as a problem with the intestines and vice versa. This can delay diagnosis and treatment, especially in the case of bowel cancer. Next question. What is the difference between an irritable bowel and an inflamed bowel? An irritated bowel cannot perform its functions effectively. It may work intermittently, move slower or faster, absorb nutrients poorly, or do so irregularly. An inflamed bowel, on the other hand, undergoes breakdown, which is also accompanied by bowel dysfunction. However, the main difference is that in inflammation, the cells of the intestine are killed. This can manifest itself in the form of erosions or ulcers, which already causes the appearance of blood and severe pain. However, at the initial stage, inflammation is practically indistinguishable in symptoms from irritation, and it is quite difficult to diagnose it independently. The next question. Why does diarrhea after coffee occur? The cause of diarrhea after drinking coffee is not related to the coffee itself. Coffee is a stimulating drink that raises blood pressure, accelerates heart rate, and stimulates intestinal peristalsis. The acceleration of peristalsis causes food to pass through the intestines more quickly, which can cause more frequent stools. This is a normal reaction to coffee and should not cause concern. However, if diarrhea occurs immediately or becomes regular after drinking coffee, it may be a reason to pay attention and monitor your condition. If these situations recur, it may be worth looking at your diet and considering whether lifestyle or other factors may be causing this reaction. In isolated cases, you shouldn't worry too much, as sometimes random situations happen in everyday life. Next question: what to do in case of food poisoning? What to do in case of food poisoning depends on the type of poisoning. Viral, bacterial, or caused by harmful substances, for example, products spoiled as a result of storage or contact with bacteria. In the case of viral poisoning, the most important thing is to provide the body with resources and water, avoiding overload, as viral infections usually go away on their own. In the case of a bacterial infection, more effort will be required and antibiotics may have to be resorted to. In both cases, the disease is accompanied by a fever. However, it is almost impossible to determine the type of infection on your own. What you can do on your own: monitor your body temperature. In case of a significant increase, contact a doctor or an ambulance. It is also important to drink enough fluids, especially if you have severe diarrhea, and to provide your body with nutrients, mainly carbohydrates and foods high in sugar. Some people may use the brat diet: bananas, rice, applesauce, toast. These are foods that are easily digested by the intestines. But in general, a standard set of nutritious foods can be helpful to the body during severe food poisoning when normal foods are not digested. Next question: what causes constipation? Constipation, like diarrhea, can occur for a variety of reasons. When doctors speak at public events, they usually talk about the most common and simple factors associated with these conditions. If we look at the statistics, the most common cause of constipation is insufficient fiber intake. People simply don't consume enough vegetables, fruits, and greens, which can lead to insufficient bowel emptying. In addition, inadequate fluid intake can also contribute to constipation, as the body draws fluid from the intestinal contents, making fecal matter dense and dry, making it difficult to pass. There are rarer causes, such as Parkinson's disease or neurological conditions, that can also cause constipation. Certain medications can also contribute to constipation. In general, there are many reasons why constipation can occur, and these are just a small fraction of them. Next question: is it normal to have food residue in your feces? If you find food residue in your feces, it may indicate that you are a very neat person, perhaps even a perfectionist, because it is not the task of the intestines to create perfect poop. This task is assigned to the person himself, who is the master or owner of his intestines. It is important to realize that not all food is digested. Proteins, fats, carbohydrates, they are digested by breaking down into smaller parts, such as amino acids, simple sugars, and fatty acids. However, plant fiber is not digested, so if you chew a carrot well, you probably won't notice it in your feces. But if you eat incorrectly or swallow in chunks, you're likely to see residue. This is similar to seeing tomato skins on the beach. There's nothing wrong with fiber passing through you undigested. It's a natural transit process. Next question: what are the signs of bacterial overgrowth syndrome in the gut? Excess bacterial growth can occur anywhere: in the eyes, ears, nose, mouth, vagina, rectum, large intestine, small intestine, even in the stomach or on the skin. Therefore, it is important to find out exactly where the overgrowth is occurring. Usually, bacterial overgrowth syndrome refers to overgrowth of microbes in the small or large intestine. However, from a medical point of view, these are different concepts, as these sections are inhabited by completely different microorganisms. However, in the public perception, these terms are often combined into one: bacterial overgrowth syndrome. This syndrome is most often defined not by the number of bacteria, but by a combination of symptoms such as abdominal bloating, gas, and stool irregularities. These symptoms are common to many gut diseases, so the designation bacterial overgrowth syndrome can be used as a temporary label for gut-related symptoms. Next question: do I need to take prebiotics and probiotics? Prebiotics and probiotics play a positive role for gut and stomach health. Prebiotics and probiotics are often talked about, but we should not forget about antibiotics, although they belong to a different topic. In fact, they are not always good for the gut. For example, in cholera or other infections caused by harmful microbes, antibiotics can harm the gut. However, sometimes they are necessary for infectious diseases. In general, the effects of probiotics and prebiotics depend on the specific situation. Probiotics add beneficial bacteria to the gut, which can be helpful if there is a lack of them, but an excess of bacteria can also be harmful. Therefore, it is important to approach their intake wisely. Studies show that probiotics can improve gastrointestinal health in some people, but this is not always beneficial. For example, some people with an overgrowth of bacteria may experience an increase in symptoms after taking probiotics. It's also important to know exactly what bacteria your gut needs, but often we don't know what microorganisms we're missing and take probiotics without enough information. When your doctor orders tests, it's important to discuss with them how they can determine the condition if you haven't already had tests. It is important to remember that bacterial content is not always analyzed in cocoa samples. In fact, most bacteria live in the surface layer of the intestinal mucosa, and their content there may be different from what is found in feces. Therefore, routine fecal tests may not be sufficiently informative. Instead, rapid diagnostic methods can be used, such as breath tests, when exhaled gases are analyzed after taking a special liquid. However, accurate determination of microbial content can be difficult and requires more advanced sample collection methods. In fact, it is not always appropriate to treat bacterial overgrowth as an independent disease, as it is often an intermediate link in the development of the disease. It is more important to treat the factors that support this process in order to interrupt the vicious cycle that contributes to the disease. Next question. How dangerous is it for the stomach to take antibiotics? Antibiotics should not be given demonic importance. They do not always negatively affect the stomach, although there are cases of irritation. It is now fashionable to criticize antibiotics, and there is even a concept of antibiotic opponent. However, people who have faced serious inflammatory diseases speak positively about them. It is important to realize that antibiotics are a tool to kill harmful microbes, and their use must be justified. If we use antibiotics correctly to fight pathogens, they can be effective. However, if they are used incorrectly or without proper need, they can cause harm. It is important to realize that each drug has a different purpose, and using them in unintended ways can be ineffective or even harmful. For example, amoxicillin with clavulanic acid, widely prescribed by dentists, does not always act directly on microorganisms, but may cause changes in fluid secretion in the intestine, leading to diarrhea. The nature of the infection should be carefully investigated and appropriate treatment selected. It should be realized that the casual or unwarranted use of both antibiotics and beneficial bacteria may be useless or even harmful. Next question. What is the danger of Helicobacter pylori? Do not underestimate the danger of Helicobacter pylori, and the need for proper diagnosis of this bacterium, known since the 1980s. It is dangerous for two reasons. It can cause a stomach ulcer or atrophy of the mucous membrane, but this is only the beginning of the problem. An ulcer can lead to complications such as bleeding or perforation, and prolonged presence can lead to stenosis or even stomach cancer. If a person has never had contact with H. pylori, the easiest way to diagnose it is to take a blood test for antibodies to this bacteria. However, for those who have already encountered this bacterium, the blood test may not be informative due to the long persistence of antibodies after infection. In such cases, a breath test, fecal analysis, or diagnosis by gastroscopy is recommended. It is important to note that treatment of H. pylori is mandatory, but the choice is left to the patient. Failure to treat can lead to more serious consequences, including gastric cancer, for which survival rates are very low in advanced stages. One of the difficulties is that the symptoms of atrophy can be subtle and go unnoticed for a long time. Visual inspection of the mucosa during gastroscopy may not be informative enough. An accurate diagnosis requires tissue samples from different parts of the stomach for microscopic examination. when a tumor has already started to form. Even with a routine gastroscopy without taking biopsy material, we may not suspect it. It appears that I have Helicobacter pylori, but it doesn't lead to anything concrete. People miss that point. If we look at the statistics, there are problems there. For example, if a person is diagnosed with pancreatitis, they just take enzymes thinking it's normal, but it's condoned. We have a lot of cancers because of that attitude. Subscriber, take responsibility for your health. Start monitoring yourself from top to bottom, and take control of your condition. If there are old problems, address them now because it is your health and no one needs it but you. Gone are the days when your health was taken care of by other people. Now it is your responsibility. If you have a good attitude towards your health, you will take care of it. If not, there will be consequences and a reduced quality of life. Pancreatitis is a very serious disease. Next question. What are the dangers of pancreatitis? You need to go to the hospital right away. You've chosen the most painful questions for today. You never know what's for the doctor, what's for the people. But it's definitely a painful question for a doctor. Look, it's about responsibility, because everyone is responsible for their own health. Because it's your responsibility to suspect. No one is going to listen to you for you. If something hurts, it's up to you to determine whether it's time to go to the doctor or not. Whether it's time to go to the hospital or not. It is on the ambulance should be called already. And this every person feels intuitively. Sometimes it is embellished or inflated by additional anxiety. When a person has a lot of anxiety, he will suspect earlier and go to the hospital earlier and do all the examinations earlier. It is such people that anxiety helps. They're always well examined and take excellent care of themselves. And those people who wait and wait think that it is too early. I'll sit tight, call an ambulance. They usually miss it. So, if you apply this specifically to pancreatitis, you have chronic pancreatitis, which comes in two forms. With the third, it's a pain somewhere in the pancreatic region that is so vague that it feels like a pull on your back. With it, no one calls the hospital soon, no one goes. An enzyme deficiency, when diarrhea is farther away than you can see. There's a mixed case of both pain and diarrhea. And then there's acute pancreatitis. That's when you're so twisted you can't stand up. And that's when you intuitively want to get closer to the hospital. And don't ignore that urge and don't try to test yourself. This is fraught with the fact that who has a pancreas exists is acute pancreatitis, passing into pancreanecrosis, when the pancreas is such a small fitulka. It begins to decompose and rot alive inside a person. Well, it's very painful, and you can die. Next question. Is it necessary to chase bile? You mentioned bile in the context of those people who were in the sanitarium and practiced the method of chasing bile. You question whether it is necessary to do this. I have tried this method myself, but not once a year as usual. But when I was preparing for Eastern practices, I found it helpful at first. It seemed to me that I felt better this way. At first I was on a protein diet for 4 days, then I switched to complete fasting or drank dried fruit compote or juice. In the evening they put a heating pad on me, and in the morning I drank a mixture of lemon juice and olive oil, then went to the toilet, where I was examined by a doctor. This procedure may have helped me, as I felt relief. But it is important to remember that racing bile can be not only unhelpful, but also harmful. Constantly stimulating bile secretion, especially without food, can irritate the intestines and cause diarrhea. In your case, if this procedure causes discomfort or negative side effects, it's probably not worth the effort and time spent. Although it can be effective for some people, it is important to monitor your body and consult your doctor before taking such steps. Next question. Does bile stagnation occur at all? In general, we can talk about a change in the consistency of bile. This is not a direct stagnation, but rather a change in its density. Bile can be either more liquid or thicker, depending on its concentration. This is analogous to the differences between thick and liquid semolina. It remains semolina, but it can vary in consistency. The problem is that if bile enters the gallbladder in too concentrated a form, it can become thick inside the bladder. Similarly, if it is diluted, it will also become liquid inside the bladder. This process repeats itself every time the gallbladder is emptied. If there are problems, It may become thick again, but if the body is healthy, it can remain liquid. Next question. Is a gastroscopy necessary? In most cases, people undergo gastroscopy without anesthesia, which is accompanied by a gag reflex or other negative reactions. The body naturally seeks to get rid of the substance introduced into the stomach, but if you haven't eaten, there's nothing there but bile to expect. However, this does not mean that the fact that bile is present in the stomach proves it has been abandoned from the intestines. There are other methods for this, such as Billy 2000, which determines the presence of LS in the bile and their periodicity. Drawing conclusions based on the gag reflex during gastroscopy can lead to erroneous conclusions about the presence of bile in all patients, which in turn can lead to unnecessary treatment. This can create the illusion of real problems, when in fact there may be none. All of this raises the question of whether gastroscopy and colonoscopy should be done annually as a preventative measure. At least once it is worth doing it to determine the presence of possible problems, even if there are no symptoms. After all, there may be hidden problems that don't show up in symptoms. However, if there are no risks, regular checkups may be redundant. It is important to respond to the onset of symptoms in order to treat them in time to prevent serious problems from developing. It is important to monitor the situation and avoid an endless cycle of examinations without addressing the underlying problem. This history of repetitive damage, repair, and errors can lead to the development of cancer problems. Almost the entire civilized world prefers to perform such procedures under anesthesia. This is not only to reduce pain or discomfort, but primarily to ensure that the endoscopist is able to qualitatively examine the organs of the internal body cavity. A normal gastroscopy with an experienced technician takes at least 10 minutes when anesthesia is used. The time spent on the procedure ensures that all aspects can be thoroughly examined and makes sure that there are no problems. On the contrary, a quick procedure that is completed in a few seconds does not allow the endoscopist to look at details. If the procedure is performed without anesthesia, the patient may experience discomfort, which hinders a quality examination. As a result, most developed countries prefer to use anesthesia for more accurate and reliable results. Next question. Should heartburn be treated? Many people suffer from heartburn, but most people just tolerate it. When asked how to treat heartburn, I passed the technique on to the gastro group. We analyze the symptoms to properly understand what heartburn is. Sometimes the sensation can be misinterpreted, making it difficult to treat. We investigate all possible causes, which can be either inside the body or in the external environment, and it is up to the person to find them. Then, based on the symptoms and the causes found, we make assumptions which we confirm with examinations. We then set goals for each examination to get answers to specific questions. Knowing the causes, we develop a suitable tool to influence specific processes. However, mistakes often occur. For example, we start treating the wrong thing or discover that heartburn is related to another condition. This leads to improper treatment and inability to get rid of H. The main cause of heartburn is usually related to excessive eating. Constant overeating leads to distension of the stomach, especially the upper part, which starts pressing on the esophagus. This leads to its damage, causing a burning sensation and heartburn due to the action of acid. To cope with this, you need to temporarily reduce the amount of food you eat to reasonable limits, and then constantly monitor your diet. It is also important to prevent damage to the esophagus by using pills that reduce acidity and reduce inflammation. Some patients also need to restore the tone of the esophagus. However, there are other causes of heartburn such as high blood pressure, neurological diseases, or individual reactions to certain foods. Studies do not confirm that coffee, alcohol, or tomatoes cause heartburn in everyone. The key in this context is controlling the volume of food and avoiding carbonated drinks, which can also contribute to heartburn. Next question. Why do some doctors say you should drink mineral water for heartburn and GI problems? I am not going to criticize or blame anyone, as this may be part of each gastroenterologist's personal approach. They may recommend mineral water for different reasons, and sometimes this can cause misunderstandings or create myths about its effectiveness. Regarding mineral water, it used to be thought that spa waters could help a variety of conditions, but it depends on the individual case. For example, People went to resorts even with cirrhosis of the liver, as well as other diseases. However, when it comes to the stomach, it is important to understand what type of mineral water is recommended. Modern options are mostly not too carbonated, as gas can trigger heartburn by causing acid reflux. Mineral water can help with bowel contraction due to its magnesium content. But it's important to remember that increasing your overall water intake can lead to the same results. Excessive consumption of carbonated beverages, including mineral water, can be detrimental to digestion. Therefore, before making any decisions regarding mineral water consumption, you should do your own research and discuss the situation with a qualified professional. Each case is different, and it is important to consider all aspects before making a decision. More information on this topic you will find on our channel. Subscribe and turn on the bell for all notifications. Please like and share this video with your friends. Thank you to our sponsors for your support. I look forward to your comments and encourage you to watch these helpful videos.